there is we have a mystery case in the oncology ward at the Royal Children's Hospital, and the child must have contracted it within the hospital because the child hasn't left the hospital.
This is precisely the issue that our public health experts in the Children's Hospital are seeking.
But is that correct? The child must have contracted the virus within the hospital.
Well, I'm not a epidemiologist, Neil, so I wouldn't like to be as
Well, how else could the child have got it? If the parents are negative, you're only allowed 2 visitors, that's your parents, they're negative. The child's positive, how else, and hasn't left hospital, how else could he have got it?
Well, I'm not in a position to say categorically one way or the other, whilst investigations are still underway.
Are you aware a lab technician has tested positive?
I'm aware that tests are underway right across everyone involved in the ward, in the families, and in other patients in the area. And until those investigations are complete, it's probably not appropriate for me.
Oh, come on, the lab technician tested positive a week before the child. Well, they're working the 4th and 5th of October. Were you aware of that?
I'm aware that a wide range of testing has been undertaken on a whole range of people.
But Minister, were you aware a staff member within the labs at the Royal Children's tested positive?
I'm aware that there's been a whole lot of testing on a whole lot of people.
That's not an answer, Minister. Were you aware that a staff member in the labs at the Royal Children had tested positive?
Neil, it's not appropriate that I give a running commentary on an investigation that is currently underway.
Why not? Why can't you at least answer that? You've answered the child. We have a child in the oncology ward who's got the virus. God willing, it's not too bad, although we get very nervous with oncology wards. We saw that at the Alfred. And it's impossible for you to tell me whether you are aware, and it's right, I can tell you, that a lab technician tested positive.
I'm aware that there's a whole heap of testing going on right across, and investigations going on right across all the possible contacts. And until that investigation is complete, Neil, it would not be appropriate for me to give a particular comment on a particular individual.
Okay, let's move on. I give up. Let's move on to something else. Why